Our next lesson is choking. So let's go ahead and move through this. This is a much more hands-on section where you can practice with someone in your household or on yourself or using a pillow. I will get into that later. So choking occurs, what's the definition of choking, is when the airway either becomes completely or partially blocked. And so this is by some sort of foreign object like food, a small toy, even bodily fluid such as vomit or blood, something like that. But it's something that impedes the airway and impedes people from ventilation or breathing. Some of the risk factors for choking, or when we typically see choking happen, is going to be when people are eating while talking or laughing or maybe eating too quickly. There are medical conditions that can lead to some sort of choking hazard. That might be neurological or musculoskeletal that affect this. And dental problems are going to be the other main source. So whether that is a dental problem that happens while someone's eating or a dental problem that was pre-existing. This is the most common cause of injury and death for children younger than 5. And if we think about it, how often we see children put things in their mouth, right? We have lots of nerve endings in our mouth and more dexterity and movement of our mouth at a younger age than we do our hands, right? So by putting it in their mouth, that's how they're learning. So when children are walking around and they're putting things in their mouth, now we have those potential choking hazards, okay? And then there's other things that come with that, like running, right? So if you're 4 years old, 5 years old, and you're running, you have something in your mouth, more likely to take a deep breath, inhale, and choke on that item. So children younger than 4, like I said, lack skills needed to chew certain types of food thoroughly. So not only do they have a different dexterity than their hands, which is why we put things in our mouths when we're younger, but it also means that if you are 4 years or younger, you don't have the same skill set, the same amount of teeth, the same amount of practice eating certain foods. And that's why we say not to feed children, we need to cut all their food small, not to feed them things like hot dogs or grapes, things to that effect. So what are the biggest hazards for children 4 or younger? Like I said, they're the most likely to choke on something. So any sort of small foods, such as nuts, seeds, popcorn, things that are round, right? So if you have something that fills your entire esophagus, or and it's round, so there's no space for air to come in and out, we run into more issues. Firm foods such as hot dogs, grapes, hard candies, like I was just mentioning. Sticky foods such as peanut butter, chewing gum, gummy candies. Large foods that break easily into small pieces, okay, so teething biscuits and cookies. And chunked foods such as fruit, raw vegetables, meat, and cheese. So all of these are a major hazard. Other things that we might see around the house that's not food per se, but small round objects such as coins, buttons, batteries, magnets, things like that. Small metal or plastic items, toys, jewelry. A lot of the time when it's for children 4 years or younger, it has to do with this hazard, right? And the size of that toy. Plastic bags, any sort of deflated balloon, something that they can inhale. Baby powder, any other sort of powder like that a child might play with. What happens is it's a powder on the outside, but when it mixes with saliva, now it's turned into this sticky, chunky issue that can impede the child's breathing. So we have 3 videos. All of these are in your module, so you can watch them separately without having to watch this entire lecture again. So let's go ahead and start off with recognizing choking. So just the overall concept of recognizing choking.
A person who is choking may look panicked, confused, or surprised, or hold the neck with one or both hands. You may hear coughing or high-pitched squeaking noises, or nothing at all. If you are with a person who starts to choke, first, ask the person if he or she is choking, or check to see if an infant is crying. Then, obtain consent to help. If the person can speak or cry or is coughing forcefully, encourage the person to keep coughing. A person who is getting enough air to speak, cry, or cough forcefully is getting enough air to breathe. But be prepared to act if the person's condition changes. If the person is making high-pitched noises or is unable to speak, cry, or cough forcefully, the airway is blocked. Have someone call 911 or the designated emergency number immediately while you begin to give first aid for choking. The person will soon become unresponsive unless the airway is cleared.
So important things to take away from this are the steps in your assignments for this module. You will notice that I provided you with PDF printouts of a step-by-step of everything to look at. But the things that you want to make sure is encouraging these people, and we'll go over this again, but if they are breathing and able to tell you that they're choking or speak to you, there's still air moving in, and the best thing you could do for them is let their body try and handle that itself. So there's a difference between adult and child choking and how you assess and treat this problem versus infant choking. We're going to talk about the differences between that. This video highlights the small modifications that you have to do between adult and child, but again, the concepts are the same. It's not until you get to infant that it's a different process.
After confirming that the person is choking and obtaining consent, give a combination of 5 back blows and 5 abdominal thrusts. First, position yourself to the side and slightly behind the person. Bend the person at the waist so that his upper body is as parallel to the ground as possible. Firmly strike the person between the shoulder blades with the heel of your hand. Give 5 back blows. After the 5th back blow, reposition yourself to stand with one foot in front of the other, placing your front foot in between the person's feet to provide balance and stability. Find his navel with 2 fingers from one hand. With your other hand, make a fist and place the thumb side against the person's stomach, right above your fingers. Cover the fist with your other hand. Give 5 abdominal thrusts, pulling inward and upward. Continue giving sets of 5 back blows and 5 abdominal thrusts until the object is forced out and the person can cough forcefully, speak, or breathe. Or, if the person becomes unresponsive, send someone to call 911 if it has not already been done. Carefully lower the person to a firm, flat surface and immediately begin CPR, starting with compressions if you are trained. For a child, you might need to kneel in order to give effective back blows and abdominal thrusts.
So like I said, the only thing that you'll notice is different. It's not the number, it's still 5 and 5. The only difference is making yourself the proper height to perform the skill set on a child. So if we want to dive into infant, we'll see what these differences are. And again, this is something that you would continue to do until the person becomes until the person is breathing again, starts to cough, and comes back, and then we're going to let their body finish the process out itself. So let's look at the differences in infant choking.
After confirming that the infant is choking and obtaining consent, give a combination of 5 back blows and 5 chest thrusts. First, place your forearm along the infant's back, cradling the back of her head with your hand. Place your other forearm along the infant's front, supporting her jaw with your thumb and fingers. Do not cover the infant's mouth. Turn the infant over and lower her onto your thigh, so she is face down with her head lower than her chest. Give 5 back blows. Firmly strike the infant between the shoulder blades with the heel of your hand. Then, reposition the infant. Place one hand along the infant's back. cradling the back of the infant's head with your hand. Next, turn her over so she is face up with her head lower than her chest. Give 5 chest thrusts. Place 2 fingers in the center of the infant's chest, just below the nipple line. Press down about 1.5 inches, then let the chest return to its normal position. Continue giving sets of 5 back blows and 5 chest thrusts until the object is forced out and the infant can cough forcefully, cry, or breathe, or until she becomes unresponsive.
So major differences here, right, is the size of the person that we're treating, the direction in which you have the infant, right? The infant head should be below the chest or body of the infant to try and have gravity assist you in trying to get the blockage out. And you're now doing the modified chest compression at the nipple line, or directly below the nipple line, I'm sorry, rather than abdominal thrusts that come in and out, right? So like I said, these videos, just like your other videos, are in the module. Re-watch these and familiarize yourself with it before you complete your assignments and submit those to me for grading. So just breaking down these steps, okay, and we're only talking about child and adult here. This is more based on practicing on yourself before practicing on another person with the same concepts, okay? So let's go through these. So the first step is verbalizing that verification that a person is choking, okay? To see if the person can speak. If the person says, yes, I'm choking, obviously not as calmly as I'm saying it now, then that means that there's still air moving in and out, right? So they feel like they're choking, it might become that issue, but you should be encouraging them to talk, okay? Now, if the person is unable to speak or is a high-pitched wheeze or is barely able to breathe, then you should be sending someone to call 911, right? A direct person pointing and telling them to call 911, or someone that you know their name and specifically say, Alex, call 911, okay? Get that AED and first aid kit and make sure that you obtain consent. So these pictures demonstrate how you can walk yourself through the steps again before practicing on someone else. So the first thing you're going to do is place your hand across your chest and grab your shoulder. That's how we're going to be grabbing the person to help guide them back and forth, right? So you're going to place the hand across your chest, grab that shoulder, and lean forward parallel to the ground, okay? Verbalize where on the back that you're going to be giving blows. So it's between the shoulder blades, making sure that you know exactly where you're going to be giving those blows. Think about where that obstruction would be, right? It's going to need to be chest level or higher because it's impeding the lungs. So it's not going to be at that abdomen or that lower back. So by giving blows there would not help. Okay, you're going to stand up, outstretch one arm with your palm facing up. You're going to take the palm of your other hand and deliver those back blows. That's you practicing that so you can have good, consistent, strong back blows. It shouldn't hurt, but it should be, right, you shouldn't be hitting as hard as you possibly can, but it should be firm and, right, we're trying to lodge something out. So get something out. So it has to have that intensity. 6 to 10 inches away with each blow. Then you're going to practice by finding the proper place on the stomach, and again, it's in and out. So 2 fingers above the belly button, make a fist. In fact, I recommend doing this as we're going through right now. That fist is 2 fingers above my belly button. I place my other hand over it, just like the picture in 3B. I push into my abdomen, and then I push up. And it comes in kind of a C or J motion. And what that's doing is, again, helping to cause pressure to hopefully dislodge whatever that issue is that's causing impeding breathing. you're going to give 5 back blows and 5 abdominal thrusts. So again, this used to be different, so it is nice the way that they are doing it now. 5 back blows, 5 abdominal thrusts for adults, for child, and the only difference for infants is instead of abdominal thrusts, you're doing compressions, but it's still a 5-to-5 ratio. You continue to do this until the person starts to cough, starts to breathe, can speak or cry, or if they become unresponsive. If they become unresponsive, you would go back to your CPR training. You'd place them on the ground and you would start going through your ABCs, checking breathing, checking airways, giving compressions to try and dislodge whatever that issue is. This week is a little bit different. Like I said, you're going to practice with people in your house or close family. If you go to dinner, something to that effect. You have to do a scenario that is child/adult. So you'll do one or the other, and there's 2 scenarios in that assignment. And then you have to do one that's an infant. I prefer that you're using some sort of baby doll so that way you can show me in the video that you upload the way that that you're not covering the mouth, and that you're placing your hands in the right place. But if you need to use a couch cushion or something else to that effect, or a rolled up towel would be even better to simulate putting back and forth and giving compressions, that would be ideal. Feel free to email me if you have any questions.